Bismillahirrahmanirrahim. Dear students, we are here with the second part of vasodilators. So students, let's have a look on the picture. I hope all of you are familiar with these three celebrities, very famous in Pakistan, and you must be knowing that they have gone through transplant surgery. And the reason for that is, of course, there is male pattern baldness, and there's another picture of your superstar. So I hope all of you can get to the point where I want to take you towards. Minoxidil, basically our drug vasodilator, it is used in the treatment of male pattern baldness, and this is the spray which is available. It comes with various brand names and various packaging, and I hope some of the students might be using them as well because it has got very good results. So one of the use of minoxidil is in male pattern baldness because it increases the hair growth. So basically, it's one of its adverse effect is it causes hypertrichosis, which is the excessive hair growth, right? So with that, we move on to the next slide. So minoxidil, it's a prodrug basically, and I hope you can recall what is a prodrug. So prodrug is that drug which is inactive as such, but when it gets into the body, it gets activated into its active form. So its active metabolite is minoxidil sulfate, and its mechanism of action is, since we classified these drugs, and it is a potassium channel opener, so it causes hyperpolarization of arteriolar smooth muscle and ultimately leading to vasodilation. Similarly, if we move on to its pharmacokinetics, it's available both in oral form and topical administration. Topical is one of the route I just showed you the picture of in scalp. It can be applied. Its bioavailability is very good. It is extremely efficacious, and its metabolism is through hepatic glucuronidation. And its duration of action is about 24 hours and half-life 4 hours. We don't have to memorize every drug's half-life and duration of action, but those drugs which have a very long duration of action or half-life, like you'll be discussing in uh, cardiovascular pharmacology when you'll do the treatment of congestive heart failure, digoxin. Then you have amiodarone, which is an antiarrhythmic drug. They have a very long duration of action, and they get accumulated in various organs and tissues of the body as well, right? And there are few drugs which have very short half life. So these drugs which have very short half life, they are ultra short acting. They are not to be given orally or intravenously, but they are given in the form of continuous infusion, right? ये तो नहीं है कि आप हर 10 मिनट, अगर एक ड्रग का हाफ लाइफ इज लाइक 5 to 10 minutes, you are going not going to give that drug after every 10 minutes. You are not going to inject the patient with that. So in that cases you give an infusion. ठीक है? So its pharmacological action, it increases the blood flow to the skin, muscles, GIT and heart. It increases the reflex increase in cardiac output and myocardial contractility and salt and water retention. So this is the universal truth for all the vasodilators. We discussed in the previous lecture that all the vasodilators, when they decrease the blood pressure, there is a compensatory increase in the salt and water retention, and there is increase in the heart rate. ठीक है, reflex tachycardia जिसको हम कहते हैं, ठीक है, that is because of the stimulation of the compensatory mechanism. So they have to be given with diuretics and beta blockers. So its indications, and indication means the condition in which the drug has to be given, which means in other words clinical uses, severe hypertension and male pattern baldness. So this indication is very important. No other drug in whole pharmacology is having this clinical use. ठीक है, तो जहाँ पे आप देखोगे male pattern baldness, you go for minoxidil. ठीक है, it's a vasodilator and it widens the blood vessels, so more blood, oxygen rich blood is delivered to the hair follicles. It helps in increase the size of hair follicles as well and promotes the growth of thicker, stronger hair. Okay? So this is the indication. As you can see, the clear-cut difference in this picture after the use of minoxidil. So adverse effects of minoxidil, these are headache, sweating, flushing, hypertrichosis. As the name is indicating, hyper means excessive and trichosis excessive hair growth on the whole body. As you can see clearly in this picture, there is a boy with abnormal excessive hair growth not only on the scalp but also on the face and the body. So this is one of the adverse effects of minoxidil, but it can be as a part and parcel of any other endocrinal abnormality or any other disease as well. But in case of minoxidil, this adverse effect can be used as its clinical use in case of male pattern baldness to increase the hair growth as well. Other adverse effects are reflex tachycardia, palpitations, angina, and edema. These are all effects because of the compensatory mechanisms and excessive hypotension and pericardial effusion. So if we move on to our next vasodilator, which is diazoxide, and its chemical structure is similar to that of thiazide diuretic, but it has got no diuretic activity. So if you can recall, thiazide diuretics are basically sulfur derivatives. So one thing is, if any person has a sulfur drug allergy, so he cannot also tolerate diazoxide, right? So its mechanism of action is it's a potassium channel opener and it causes hyperpolarization of arteriolar smooth muscle and stabilizes membrane potential at resting levels. So far we have covered minoxidil and hydralazine. Hydralazine was a nitric oxide donor and through the release of NO it was causing vasodilation, whereas minoxidil and diazoxide, both of them are potassium channel openers. So regarding the pharmacokinetics of diazoxide, it is administered parenterally. It is excessively bound to albumin and vascular tissue. It's partially metabolized and remainder is excreted unchanged. Half-life is 1 day. It's long-acting and very effective, ठीक and rapidly lowers the blood pressure when given through injection. So indications, once again, indication means clinical uses. It is used in hypertensive emergency because it has got a rapid onset of action. It stays for a longer duration of action and it is given through parenteral route. And to treat the hypoglycemia secondary to insulinoma. So this is another important unique indication of this vasodilator. In whole pharmacology, once again, I would like to mention that insulinoma, you won't hear this word again, except for in this condition of diazoxide. The name is indicating insulinoma. It's a tumor, okay, which of the beta cells which secrete excessive amount of insulin. Okay? So whenever there is excessive amount of insulin, the function of insulin is to decrease the blood glucose level. So as a result, there would be hypoglycemia. So what is the indication of diazoxide? Diazoxide basically causes hyperglycemia. So if a patient has an insulinoma and because of excessive insulin, there is hypoglycemia, we can give diazoxide as it causes hyperglycemia. And how does it cause hyperglycemia? That would be insulin secretion is dependent upon the ATP sensitive potassium channels when it is released through the beta cells of pancreas. So diazoxide inhibits the secretion of insulin, right? Since it's a potassium channel opener, so it is going to inhibit the secretion of insulin by opening of potassium sensitive channels. As we'll be discussing endocrine pharmacology, where we'll be discussing in detail the release of insulin is dependent upon the ATP sensitive potassium channel. So diazoxide is causing hyperglycemia overall. So you have to give diazoxide in caution with a patient of diabetes mellitus. So this is one of its caution. Adverse effects of diazoxide, which are excessive hypotension and can precipitate stroke and MI, hyperglycemia. You know why it is causing hyperglycemia, because it is inhibiting the release of insulin. Can provoke angina, ischemia, and cardiac failure in patients with ischemic heart disease. That is because of its compensatory mechanisms. अगर एक पेशेंट को ऑलरेडी हार्ट फेलियर है और कॉम्पनसेटरी मैकेनिज्म अवोक होते हैं और टैकीकार्डिया होता है, हार्ट पे लोड बढ़ता है, वर्क लोड बढ़ता है, तो इट कैन प्रेसिपिटेट these conditions. So that is why vasodilators should be given with other two drug groups, which are diuretics and beta blockers. So our next drug is phenoldopam. Its structure is as shown. It's a dopa agonist and D1 agonist and causes dilation of peripheral arteries as well as natriuresis, ठीक है, which is the excessive release secretion of sodium in the urine. And D1 agonist, it often comes in your MCQ. Phenoldiazepam is a, आपको दिया होगा D1 agonist है, D2 है या antagonist है, so it's a D1 agonist. And if you can recall from the chapter of your ANS where the distribution of different dopamine receptors, the second messengers, and the drugs which are acting on dopamine receptors, so phenoldiazepam is a D1 agonist. It is administered by continuous intravenous infusion. It is metabolized by conjugation, which is a phase 2 reaction of biotransformation. Its half-life is only 10 minutes. That is why we give it through continuous infusion. Its indications is hypertensive emergencies, post-op hypertension, and adverse effects are increased in the heart rate but reflexly, headache, flushing, increases intraocular pressure as well. So this drug is to be given in caution with patients with glaucoma as well. सो यू हैव टू रिमेंबर कि जो आपकी हाइपरटेंसिव इमरजेंसीज होती हैं उसमें आपने स्पेशली वो ड्रग्स देनी हैं जो पारेंट्रल रूट के थ्रू देते हैं जिनकी ऑनसेट ऑफ एक्शन इज़ वेरी फास्ट, ठीक है। ये नहीं कि एक ड्रग का ऑनसेट ऑफ एक्शन इज़ 12 आवर्स तो आप उसको हाइपरटेंसिव इमरजेंसी में दे दो, ठीक है। इट्स अ लाइफ थ्रेटनिंग कंडीशन जो हाइपरटेंसिव क्राइसिस है या हाइपरटेंसिव इमरजेंसी है, जिसको मेलिग्नेंट हाइपरटेंशन भी कहते हैं, so it has to be treated as a medical emergency. So you have to give parenteral drugs. So we move on to our next drug, which is sodium nitroprusside. And as we discussed in the classification, it is acting both on the level of arterioles and venules, and it's a complex of iron, cyanide, and nitroso moiety. As you can see clearly from this picture, it's a combo of iron, cyanide, and nitro. It's a powerful vasodilator and it's a rapid onset of action, so it is also given for parenteral route for hypertensive emergencies. So regarding its pharmacokinetics, it is administered by IV infusion. It's rapid acting and has high efficacy, and duration of action is 2 to 5 minutes, which is very short acting. And one thing unique about its pharmacokinetic is it is taken up into red blood cells and then it gets spontaneously decomposed into NO, which is nitric oxide, and cyanide. And you must have heard about cyanide. So cyanide is not a safe type of metabolite, it's a toxic metabolite. So cyanide is metabolized in the liver further to thiocyanate, which is distributed in extracellular fluid and slowly eliminated by kidney. Its half-life is about 3 days. So dose, it's basically we started with low dose of 0.5 microgram per kg per minute and then increase up to 10. And higher rates of infusion for more than 1 hour can lead to toxicity. Okay? So you should always administer it with infusion pump and it should be monitored. It is sensitive to light and should be made fresh each time and should be kept in opaque foil, covered in opaque foil. So regarding the mechanism of action of nitroprusside, it is dilating both the arterial and venous vessels and thereby decreasing peripheral vascular resistance and venous return. So it's in its mechanism of action, as we can clearly appreciate this diagram as you can see. Let's have a quick look on it. Sodium nitroprusside is basically nitric oxide releaser, and this nitric oxide then activates guanylyl cyclase, which causes the conversion of GTP into cyclic GMP, and the cyclic GMP is then responsible for the relaxation of vascular smooth muscle through the myosin light chain. And organic nitrates, which we'll be discussing in anti-anginal drugs, they are also acting through the same mechanism, and they get converted into nitrites, and then they cause the activation of this cyclic GMP and vascular smooth muscle relaxation. So this is how sodium nitroprusside and nitrates cause vasodilation, and the rest of the drugs which we have already covered, minoxidil, diazoxide, and hydralazine, they have different mechanism as compared to this nitroprusside. So regarding the pharmacokinetics of diazoxide, it is administered parenterally. It is excessively bound to albumin and vascular tissue. It's partially metabolized and remainder is excreted unchanged. Half-life is 1 day. It's long-acting and very effective, ठीक है, and rapidly lowers the blood pressure when. So we move on to our next drug, which is sodium nitroprusside. And as we discussed in the classification, it is acting both on the level of arterioles and venules, and it's a complex of iron, cyanide, and nitroso moiety. As you can see clearly from this picture, it's a combo of iron, cyanide, and nitro. It's a powerful vasodilator and it's a rapid onset of action, so it is also given for parenteral route for hypertensive emergencies. So, thiocyanate toxicity is occurring especially in patients with renal insufficiency. And serum concentration, if it is more than 10 milligrams per deciliter, this is characterized by weakness, disorientation, psychosis, muscle spasm, convulsions, and hypothyroidism. And this is sodium nitroprusside, which is we discussed initially at the beginning that it's consisting of cyanide, five cyanide groups, and one nitroso moiety and iron. And what is happening actually, sodium nitroprusside, it gets converted into NO, releases NO, which causes vasodilation. But at the same time, it is also releasing cyanide, which enters into the liver, and in the liver, it gets converted into thiocyanate, and thiocyanate, since it is excreted through kidneys, but if the kidney is damaged or kidney function is impaired, then there is chances of accumulation of thiocyanate. So, and thiocyanate is toxic. So we can lead to it can lead to the toxicity of thiocyanate, which can lead to acid-base imbalance and cardiac arrhythmias. And just we discussed disorientation, psychosis, muscle spasm, and seizures. And to treat this toxicity at this level, we can give sodium thiosulfate, and I just told you, okay, we can give these two drugs so that they are converted into lesser toxic metabolite, and hence we can treat the cyanide toxicity secondary to sodium nitroprusside. So this is once again the same thing. Cyanide toxicity is occurring because it is metabolized in the liver to thiocyanate via thiosulfate, and thiocyanate is eliminated kidney. Both cyanide and thiocyanate, they cause toxicity. So our aim is to convert these thiocyanate into lesser toxic agent so that it's eliminated from the body. So we give sodium thiosulfate, ठीक है. And the important thing is that you should always protect the sodium nitroprusside from light. As we discussed, that it should be wrapped in a opaque bottle, and it should be prepared fresh every time, and since it lowers the risk of cyanide toxicity in this if we take care of these precautions. And with that, that's the end of the lecture. Thank you very much, students, and I hope all of you have understood the vasodilators. And vasodilators are very important since they are not only covered alone as a topic, but also they come under the domain of anti-anginal and antihypertensives and many more. You will be discussing them chunk by chunk in various cardiovascular diseases. So you must memorize one thing, that vasodilators should not be given alone, number one. Number two, the key point of each of the vasodilator, the different mode of action and its one unique adverse effect. Like in minoxidil, you can memorize whenever you see minoxidil, you just remember male pattern baldness is its use, and hypertrichosis it's one of the adverse effects. Then if you come to hydroxyzine, the name it comes with like SLE-like syndrome because of fast and slow acetylation. It can cause toxicity as well if it's a slow acetylators. Then for diazoxide, you can memorize to treat the insulinoma because it this drug itself causes hyperglycemia. ठीक है, तो ये इसके important points हैं. And similarly for nitroprusside you can remember cyanide toxicity, और इसको treat करने के लिए हम जैसे sodium thiosulfate दे रहे हैं, ठीक है, methemoglobin दे रहे हैं. तो these are the important points, and it's not a very difficult topic, but still, if you have confusions, you are free to ask and you are more than welcome. And with that, I'll be sending you assignments in a short while that you have to complete within your lecture timing. Thank you, students. Allah Hafiz.